If you think infection control is basic, this video is about to humble you. Welcome back to MCQs Master 101, where we don't train beginners, we train Nclex finishers. These are 50 infection control questions written the way the Nclex actually thinks. Layered precautions, isolation traps, PPE sequencing, transport rules, and real exam logic. No memorization, no standard precautions freebies. Every question is designed to make you pause, second guess, and earn the point. If you score 40 or more, you're exam ready. If you don't, good, that's why you're here. Grab a pen, lock in. Let's see how dangerous your infection control really is.
Question 1. A nurse is caring for a client with active pulmonary tuberculosis. Which personal protective equipment, PPE, is required when entering the room? A. Surgical mask. B. N95 respirator. C. Face shield only. D. Gown and gloves only. Answer: B. N95 respirator. Rationale: TB is an airborne infection requiring a fit-tested N95 respirator. Surgical masks are insufficient. Question 2. Which client requires airborne precautions? A. Clostridioides difficile infection. B. Influenza. C. Measles. D. MRSA wound infection. Answer: C. Measles. Rationale: measles spreads via airborne droplet nuclei. C. Diff requires contact precautions. Question 3. A nurse is removing PPE after caring for a client on contact precautions. Which item should be removed first? A. Gown. B. Gloves. C. Face shield. D. Mask. Answer: B. Gloves. Rationale: gloves are the most contaminated and must be removed first to prevent self-contamination. Question 4. Which action is most effective in preventing healthcare-associated infections, HAIs? A. Wearing gloves. B. Using alcohol wipes. C. Hand hygiene. D. Proper waste disposal. Answer: C. Hand hygiene. Rationale: hand hygiene is the single most effective measure to prevent HAIs. Question 5. A client with suspected meningococcal meningitis is admitted. Which precautions are required? A. Contact. B. Airborne. C. Droplet. D. Standard only. Answer: C. Droplet. Rationale: Neisseria meningitidis spreads via respiratory droplets. Question 6. Which client can share a room with a client who has influenza? A. Client with neutropenia. B. Client with heart failure. C. Client with RSV. D. Client with pneumonia of unknown cause. Answer: C. Client with RSV. Rationale: cohorting is allowed when clients have the same type of infection and precautions. Question 7. A nurse is caring for a client with Clostridioides difficile. Which hand hygiene method is required? A. Alcohol-based sanitizer. B. Antimicrobial soap only. C. Soap and water. D. Chlorhexidine wipes. Answer: C. Soap and water. Rationale: alcohol does not kill C. diff spores, soap and water are required. Question 8. Which PPE is required for droplet precautions? A. N95 respirator. B. Surgical mask. C. Gown only. D. Gloves only. Answer: B. Surgical mask. Rationale: droplet infections require a surgical mask within 3 to 6 feet of the client. Question 9. A nurse prepares to insert a urinary catheter. Which action breaks sterile technique? A. Using sterile gloves. B. Touching the catheter tip. C. Maintaining a sterile field. D. Cleansing the urethral meatus. Answer, B. Touching the catheter tip. Rationale, touching sterile equipment contaminates it and breaks sterile technique. Question 10. Which infection requires contact precautions? A. Varicella. B. Tuberculosis. C. MRSA. D. Measles. Answer, C. MRSA. Rationale, MRSA spreads via direct and indirect contact. Question 11. Which client should the nurse place in a negative pressure room? A. Influenza. B. COVID-19 aerosol generating procedure. C. Diff. D. RSV. Answer, B. COVID-19 with aerosol generating procedure. Rationale, aerosol generating procedures require airborne isolation with negative pressure. Question 12. A nurse accidentally experiences a needle stick injury. What is the priority action? A. Notify the manager. B. Complete an incident report. C. Wash the area immediately. D. Obtain post-exposure prophylaxis. Answer, C. Wash the area immediately. Rationale, immediate cleansing reduces pathogen transmission risk. Question 13. Which item must remain sterile during a central line dressing change? A. Gloves after removal. B. Catheter insertion site. C. Skin around the site. D. Tape edges. Answer, B. Catheter insertion site. Rationale. The insertion site is a direct entry point for pathogens. Question 14. Which client requires protective, reverse, isolation? A. Active TB. B. Chemotherapy-induced neutropenia. C. Diff. D. Influenza. Answer, B. Chemotherapy-induced neutropenia. Rationale, protective isolation prevents exposure in immunocompromised clients. Question 15. A nurse removes gloves after wound care and then touches the bed rail. This action demonstrates which principle? A. Asepsis. B. Contamination. C. Sterilization. D. Disinfection. Answer, B. Contamination. Rationale. Touching surfaces with contaminated gloves spreads microorganisms. Question 16. Which infection requires both contact and droplet precautions? A. Influenza. B. RSV. C. Diff. D. TB. Answer, B. RSV. Rationale, RSV spreads via droplets and contaminated surfaces. Question 17. When is alcohol-based hand sanitizer contraindicated? A. After glove removal. B. Before medication administration. C. When hands are visibly soiled. D. After touching intact skin. Answer, C. When hands are visibly soiled. Rationale, visible soil requires soap and water, not sanitizer. Question 18. Which PPE is required when suctioning a client with a tracheostomy? A. Gloves only. B. Mask only. C. Gloves and eye protection. D. Gown only. Answer, C. Gloves and eye protection. Rationale, suctioning may generate splashes and aerosols. Question 19. Which action best prevents surgical site infections? A. Prophylactic antibiotics. B. Proper hand hygiene. C. Early ambulation. D. Sterile dressings. Answer, B. Proper hand hygiene. Rationale, hand hygiene remains the most effective prevention method. Question 20. Which client must wear a mask when leaving the room? A. Neutropenic client. B. Client with MRSA. C. Client with TB. D. Client with C. diff. Answer, C. Client with TB. Rationale, TB clients must wear surgical masks during transport. Question 21. A nurse is caring for a client with shingles, herpes zoster. Which precautions are required? A. Contact only. B. Droplet only. C. Airborne only. D. Contact and airborne. Answer, D. Contact and airborne. Rationale, disseminated or uncovered shingles require both contact and airborne precautions. Question 22. Which action by the nurse best prevents transmission of vancomycin-resistant enterococcus, VRE? A. Wearing an N95 respirator. B. Hand hygiene before and after care. C. Using sterile gloves. D. Placing the client in a negative pressure room. Answer, B. Hand hygiene before and after care. Rationale, VRE spreads via contact. Strict hand hygiene is essential. Question 23. A client with C. difficile infection requires transport to radiology. Which action is appropriate? A. Client wears an N95 respirator. B. Client wears a surgical mask. C. Cover the client with a clean sheet. D. Cancel the procedure. Answer, C. Cover the client with a clean sheet. Rationale, C. Diff is contact-based, masking is unnecessary, but contamination prevention is required. Question 24. Which client should be placed in a private room? A. Client with MRSA and draining wound. B. Client with hypertension. C. Client with diabetes. D. Client with chronic kidney disease. Answer, A. Client with MRSA and draining wound. Rationale, active drainage increases transmission risk and requires isolation. Question 25. A nurse is donning PPE before entering an isolation room. Which item is applied last? A. Gown. B. Mask. C. Goggles. D. Gloves. Answer, D. Gloves. Rationale, gloves are applied last to maintain sterility and proper coverage. Question 26. Which organism requires soap and water hand hygiene instead of alcohol-based sanitizer? A. MRSA. B. Influenza. C. Norovirus. D. RSV. Answer, C. Norovirus. Rationale, spore-forming and non-enveloped viruses require soap and water. Question 27. Which situation requires sterile gloves instead of clean gloves? A. Changing a peripheral for dressing. B. Administering oral medication. C. Suctioning a tracheostomy. D. Inserting a urinary catheter. Answer, D. Inserting a urinary catheter. Rationale, invasive procedures entering sterile body sites require sterile technique. Question 28. A nurse exits the room of a client on airborne precautions. What is the correct sequence for removing PPE? A. Gloves, gown, mask. B. Mask, gloves, gown. C. Gown, gloves, mask. D. Gloves, mask, gown. Answer, gloves, gown, mask. Rationale, mask is removed last to prevent inhalation of airborne pathogens. Question 29. Which client is at highest risk for healthcare-associated infection, HAI? A. Client with hypertension. B. Postoperative client with a urinary catheter. C. Client receiving oral antibiotics. D. Client ambulating independently. Answer, B. Postoperative client with a urinary catheter. Rationale. Invasive devices significantly increase infection risk. Question 30. Which precaution is required for a client with pertussis? A. Contact. B. Airborne. C. Droplet. D. Standard only. Answer, C. Droplet. Rationale, pertussis spreads through respiratory droplets. Question 31. Which action indicates correct sterile field maintenance? A. Holding hands above waist level. B. Turning back on sterile field. C. Reaching across sterile field. D. Letting sterile gloves touch clothing. Answer, A. Holding hands above waist level. Rationale, sterile items must remain above waist and in view. Question 32. Which PPE is required when caring for a client with Ebola? A. Gloves only. B. Gown and gloves. C. Full PPE including face shield. D. Surgical mask only. Answer, C. Full PPE including face shield. Rationale, Ebola requires enhanced contact and droplet precautions due to high infectivity. Question 33. Which finding suggests a break in infection control technique? A. Hand hygiene before patient contact. B. Wearing gloves for blood exposure. C. Reusing a gown between clients. D. Proper disposal of sharps. Answer, C. Reusing a gown between clients. Rationale, PPE must be changed between clients to prevent cross-contamination. Question 34. A nurse is caring for a client with neutropenia. Which food should be avoided? A. Cooked chicken. B. Pasteurized milk. C. Fresh raw vegetables. D. Canned soup. Answer, C. Fresh raw vegetables. Rationale, raw foods increase infection risk in immunocompromised clients. Question 35. Which type of isolation protects the client, not the nurse? A. Contact. B. Droplet. C. Airborne. D. Protective. Answer, D. Protective. Rationale, protective, reverse, isolation prevents exposure to pathogens. Question 36. Which client requires standard precautions only? A. MRSA wound. B. Influenza. C. HIV infection. D. C. Diff. Answer, C. HIV infection. Rationale, HIV is bloodborne, standard precautions are sufficient. Question 37. Which action is appropriate when disposing of sharps? A. Recap needles. B. Bend the needle. C. Dispose immediately after use. D. Remove needle from syringe. Answer, C. Dispose immediately after use. Rationale, immediate disposal reduces needle stick injury risk. Question 38. Which client should the nurse see first to prevent infection spread? A. Client requesting pain medication. B. Client with a leaking wound dressing. C. Client waiting for discharge teaching. D. Client eating breakfast. Answer, B. Client with a leaking wound dressing. Rationale, drainage increases risk of environmental contamination. Question 39. Which statement about alcohol-based hand sanitizers is correct? A. They kill bacterial spores. B. They replace soap and water. C. They are effective on visibly clean hands. D. They eliminate all microorganisms. Answer, C. They are effective on visibly clean hands. Rationale, sanitizers are ineffective against spores and visible soil. Question 40. Which client requires droplet precautions plus eye protection? A. TB. B. RSV. C. Varicella. D. C. Diff. Answer, B. RSV. Rationale. RSV spreads via droplets and secretions contacting mucous membranes. Question 41. Which intervention best reduces catheter-associated urinary tract infections, CAUTI. A. Routine catheter irrigation. B. Early catheter removal. C. Prophylactic antibiotics. D. Sterile urine bags. Answer: B. Early catheter removal. Rationale: limiting catheter duration is the most effective prevention strategy. Question 42. Which client must wear a mask during transport? A. Neutropenic client. B. Client with MRSA. C. Client with influenza. D. Client with C. diff. Answer: C. Client with influenza. Rationale: droplet precautions require masking during transport. Question 43. A nurse notes redness and warmth at N4 site. What is the priority action? A. Apply heat. B. Flush the 4. C. Remove the 4 catheter. D. Administer antibiotics. Answer: C. Remove the 4 catheter. Rationale: signs of infection require immediate removal to prevent bloodstream infection. Question 44. Which infection is transmitted via fecal-oral route? A. Influenza. B. Hepatitis A. C. TB. D. Varicella. Answer: B. Hepatitis A. Rationale: hepatitis A spreads through contaminated food and water. Question 45. Which PPE is required when cleaning a large blood spill? A. Gloves only. B. Gloves and gown. C. Gloves, gown, and eye protection. D. Mask only. Answer: C. Gloves, gown, and eye protection. Rationale: splash risk requires full barrier protection. Question 46. Which factor increases the risk of surgical site infection? A. Early ambulation. B. Poor glycemic control. C. Adequate nutrition. D. Timely antibiotic prophylaxis. Answer: B. Poor glycemic control. Rationale: hyperglycemia impairs wound healing and immunity. Question 47. Which action demonstrates correct glove use? A. Wearing the same gloves between tasks. B. Removing gloves after each client. C. Washing gloves with sanitizer. D. Reusing gloves if intact. Answer: B. Removing gloves after each client. Rationale: gloves are single-use and task-specific. Question 48. Which client requires standard and contact precautions? A. Influenza. B. TB. C. Scabies. D. Measles. Answer: C. Scabies. Rationale: scabies spreads via direct skin contact. Question 49. Which action by a nurse breaks protective isolation? A. Wearing a mask. B. Performing hand hygiene. C. Bringing fresh flowers into the room. D. Using dedicated equipment. Answer: C. Bringing fresh flowers into the room. Rationale: plants and flowers harbor microorganisms harmful to immunocompromised clients. Question 50. Which principle best explains why hand hygiene is required before and after every patient contact? A. Legal protection. B. Standard precautions. C. Chain of infection interruption. D. Professional accountability. Answer: C. Chain of infection interruption. Rationale: hand hygiene breaks transmission at the most critical point in the infection cycle.
If this video felt uncomfortable, that's exactly how the Nclex feels. Infection control isn't about knowing precautions. It's about knowing when, why, and what the Nclex expects you to prioritize under pressure. If you struggled, don't panic. Analyze the rationales. That's where passing nurses are separated from repeat test takers. Drop your score in the comments. No shame, just honesty. Subscribe to MCQs Master 101 because we don't lower the difficulty, we raise your level. Next video, harder questions, smarter traps, zero mercy. Until then, study smart, stay clinical, and I'll see you in the next Nclex grind.